Hey everyone, in this video we're going to talk about glucagon and some of the other counter-regulatory hormones that are related to diabetes and the usage of insulin in the body. This is a really important unit. This is going to give you what you need to know to understand the glucagon insulin feedback loop that is so important to understanding diabetes. Now that we have a really good understanding of what insulin does in the body, we can talk about the counter-regulatory hormones. So counter-regulatory hormones are exactly what you think they would be. They are hormones that work against insulin in the body. So if insulin's main job is to take glucose out of the blood and either use it or store it, then the job of these hormones is to increase the amount of glucose in the blood. The main kind of counter-regulatory hormone is glucagon. So we'll talk later about the glucagon insulin feedback system. But this is kind of, when you look up insulin on the internet or you look it up in a textbook, what you're going to see most likely is this kind of relationship between glucagon and insulin, and how when one goes up the other goes down, and they are working against each other in this counter-regulatory fashion that controls glucose in the body. So for me, I find it easier to kind of go through insulin, make sure I know exactly what insulin is doing, what the point of insulin is, and then I can go from there in terms of figuring out what the rest of these hormones do. So there are 4, maybe 5, depending on how you look at it, of different counter-regulatory hormones, and they're all listed right here for you. So the first and the most important is glucagon. So glucagon is secreted by the alpha cells in the islets of Langerhans. So if we look down, this is kind of a similar kind of drawing to what we looked at earlier. Here's your islet cell, and you've got some alpha cells and beta cells and delta cells. And again, we know that the beta cells are going to release insulin. It is the alpha cells in the islets of Langerhans that release glucagon. Like insulin, the glucagon travels through the blood to the liver, and that's where it does its main job. Only instead of decreasing blood glucose, instead of getting the glucose out of the blood, glucagon's job is to get more glucose into the blood. And so when it gets to the liver, instead of packing away the glucose that's available in the blood into these glycogen chains and storing them, it actually takes those glycogen chains and it breaks them up so that they form glucose again and sends them out into the blood. And that's because glycogen, as a counter-regulatory hormone, loves to increase the amount of glucose we have in the blood. It's going to go to the places where insulin has stored glucose, and it's going to try to release that glucose. And remember when we looked over here at the things that insulin works against, right? And one of them was glycogenolysis. Right? And this is what we're talking about when we talk about what glucagon does in the liver. Glucagon, because it works against insulin, is actually going to increase glycogenolysis. It's going to take these glycogen chains and break them all up and send that glucose back out into the blood. These other 4 counter-regulatory hormones I'm sure are familiar to you: epinephrine, growth hormone, cortisol, and glucocorticoids. You can kind of lump these last 2 together into the same category. So you know that epinephrine is a hormone that's secreted by the adrenal medulla. This is the same hormone that's released during that fight or flight response. It's that sympathetic nervous system response to some kind of stress on the body. So if you just think about it logically, when the body is experiencing a fight or flight response, it needs all of the energy it can possibly get to be available in the blood so that it can be used. And so epinephrine will stimulate glycogenolysis as well. So it'll take that glycogen in the liver and chop it back up and send it back out into the blood as glucose. One of the other things it does is it actually inhibits insulin release, because we actually don't want to break down any glucose when we're in a fight or flight response. We want to keep that glucose in the blood. We're going to need to use it. So it inhibits insulin, and then it increases the availability of glucose for the brain and for the nervous system. So, and then I always look at growth hormone as something that's released during fasting or starvation. It decreases the effects of insulin, meaning it's going to keep glucose in the blood longer for use. It also decreases cellular uptake of glucose, which means instead of that glucose being used by the musculoskeletal cells and by fat cells, it's actually still going to be floating around in the body. So if you really just think about these counter-regulatory hormones as being hormones that want to keep glucose in the blood. So if you look back down at this list we talked about earlier, they're going to do all of the things that are going to increase glucose in the blood. I'm not going to do it now, but you can do the same way we did it in the insulin video, which is go through these things one at a time and decide for yourself whether or not they are increasing glucose in the blood or decreasing glucose in the blood, and then you can assign them to either insulin or glucagon. So those of you who know me know that I love these little kind of mind maps. It really helps me to kind of put the information together. So what is it exactly that's going to trigger a release of these counter-regulatory hormones? We know that insulin, we talked in the first video about how insulin is released when there is a lot of glucose in the blood. So after you eat, you have a rise in your glucose level, and then insulin will be released and will bring that glucose level back down. The opposite is true about counter-regulatory hormones. They are triggered or released when there is too little glucose in the blood. So when we're experiencing hypoglycemia. And so if you kind of just follow this little map, I'm not going to go through it all because we actually talked about all of the things when we were looking at this list here, but you can take a look at this later and kind of follow your way through. The most important thing to know is that at the end of these paths, they're all going to lead to a place where we have an increase in glucose in the blood.